Welcome to the Human Capital Innovations Podcast, your go-to source for personal, professional, and organizational growth and development. We hope you tune in often for all things people management, organizational development and change, organizational leadership, and social impact related. Maximize your personal and organizational potential with Human Capital Innovations Podcast. Welcome to the Human Capital Innovations Podcast. In this HCI podcast episode, HCI Research Associate Dr. Leandra Hernandez and her colleagues continue their weekly COVID-19 Convo via Facebook Live to discuss all things COVID-19 related.
Well, so I don't know. Should we kick this thing off?
Sure.
I was thinking, Kari, about what you said about the kind of the desire to blame, the desire to find a patient zero, to assign a point of origin, and the news that came out in the Times just recently that said most of the cases on the East Coast were seeded by people who had the virus caught the virus in Europe. They can tell that by the RNA signatures of the virus, that it was, those sort of micro changes that as the virus mutates, that it was actually from European travel that seeded most of the virus on the East Coast. And of course, at one level, that really doesn't make any difference at all. I mean, it's the same virus, it's the same ultimate viral origin. But why does that matter so much to us? And we see so many people, certainly I see them on social media, wanting to assign blame and all the kind of anti-Asian racism that goes with that.
Mm-hmm. Mm-hmm.
And then, this, and of course, part of it is politics. We blocked travel from China, which actually didn't happen, but whatever. But in fact, it was really coming in from Europe at that time. That's really where we got the majority of our East Coast illnesses. And, what are the differing mechanisms of blame for cultures that we feel are more like us versus, hello.
Hey, Meaghan, you made it.
Hi, everyone. I'm Meaghan. I don't have Facebook, so I was really confused about how I was trying to connect at first.
Well, yay, we're glad you're here. Meaghan is one of my amazing colleagues in our communication department at UVU. Meaghan, do you want to tell everyone a little bit about your research interests and whatnot?
Yeah, sure. So I am in the comm department with Leah at UVU. I'm in the public relations emphasis. I'm a quantitative survey researcher. I've done a lot of research in science and environmental communication. And my kind of interesting tie to the COVID-19 discussion is really that I've been teaching for the first time this semester crisis communication. And so really it's been this kind of ongoing case study, that first started very removed as we talked about what was going on in China and then in Europe and then here and how it's influencing everyone's lives. So it's been challenging but rewarding to teach that class right now, for sure.
Yeah, I'm sure.
It has a lot of really good connections to what Pamela was saying too.
I was just following up on something that Kari has been talking to her students about, which is the obsession with finding an origin for a disease or finding a patient zero and then kind of evaluating their behavior, right? Like, did they cause this? Is it someone's fault? Mm-hmm. And the news that recently came out in the New York Times that actually the variant of the coronavirus that is circulating most on the East Coast actually came from people traveling from Europe. So all of the kind of discussions of we closed the border with China, which in fact didn't happen, but that we blocked the source of contagion, really that's not where it was coming from at the time that it was that it was being seeded at multiple places on the East Coast. So we're thinking about blaming and what the mechanisms of blaming are.
Yeah.
So it's been interesting to see that evolve. So how do you each deal with that in your various disciplines and courses and lives?
Yeah. So I told you all in week 1 that I teach health communication primarily, but I'm also a media studies person, right? And media ethics. And I've been spending a lot of time this semester with my students trying to critically deconstruct the media representation angle of it, particularly from the xenophobia perspective. So in class, we talk a lot about the way in which perceptions spread about COVID. And we talked about it a little bit last week, right? When we were focusing on scapegoating. Like, I think it's easier for the larger American public to, and I don't want to generalize, but I think segments maybe to feel better about the disease or the virus from a self-efficacy perspective if they know where it came from, right? There's someone you can pin it on from a blame perspective, which kind of creates that further self-distancing. And like when Pamela, you were talking about the origins on the East Coast in terms of it really coming from Europe, like I don't recall seeing that much in the news as much as I would have liked, right? Like how is that information getting disseminated or not? And how is the American public really being informed of that part or not?
Right. I mean, it was in the New York Times, but I think that's maybe the kind of news that takes, it's harder to put in a soundbite because it involves things like mutations and people don't really quite understand what's going on with that. And so, it's not the kind of above the fold big headline that's easily digested.
Yeah.
It seems like it relates to a lot of the stuff we've been seeing about, I've seen a lot of talk about like the military fighting sort of metaphor for the disease. Like, oh, we need to, like with Boris Johnson, when
he's a fighter.
He's a fighter, so he'll be okay, right? Like, I see why people use that kind of language and how it can feel reassuring, but at the same time, it's like, that's not really how viruses work, right? Like, but we love to use those fighting and bravery and courage sorts of metaphors to talk about our immune systems working or not working to fight off a disease.
Right.
Yeah. And Trump, how he's saying, I'm a wartime president. This is
who won't deploy the Defense Act, but okay.
And having a nation of origin kind of ties in with that, like, oh, we're fighting this disease that came from, wherever it came from, but it seems like people are more comfortable saying it came from China. We're fighting.
Yeah. And I mean, we all know language matters, right? It's what we do. It's what we research. It's what we talk about. And it's interesting to see a lot of the health communication research that looks on metaphor, particularly with illness and disease, right? So we're battling cancer. We are survivors. It's the same kind of rhetoric that's utilized in all of the marketing campaigns for like major hospitals and healthcare organizations, right? But it just doesn't fit as well for me when you think about it being like an internal sort of illness manifestation like cancer versus a virus, right? And I don't know if we know enough about it now in this current moment, but it'll be interesting to see like what the broader implications are of the war battle metaphor for COVID in terms of how larger populations make sense of the disease and whether or not that galvanizes perhaps more or less like social distancing and adherence to a lot of the public health messages.
Right.
And I think that those metaphors also are so relatable to what the conversations you're hearing about in the hospital too, like, putting on their PPE, their protection before going to face
battle
the
gear.
disease. Yeah, exactly.
Lorenzo Cerviche, whom some of you know, has a book on the mobilization of kind of military metaphors in dealing with public health issues. And the problem with a lot of these military metaphors, I mean, it falls in sort of naturally when you have to have a whole society or, mobilization, right? Because very often you are using laws for appropriations that are in fact linked to wartime or disaster situations. But very often the war on what have you, the war on poverty becomes a war on the poor, right? The war on drugs becomes a war on drugs in people's bodies, becomes a war on people who take drugs.
And a particular body and like racial ideology embedded within that too.
Yeah, exactly. And we're seeing, of course, enormous disparities in the impact and the mortality of the disease across racial categories, et cetera, categories of income. And that also will fold in as the virus continues to make its way into our everyday life. That's also going to fold into the way that people perceive other groups.
Yeah. Oh, yeah. We have a question here. Laura says the government is considering reopening the economy in May. How will we normal human beings reopen this new challenging lifestyle? I think that's a great question. Any thoughts?
I think it's hard to answer when we don't know what that lifestyle is going to be. We don't know the extent to these changes. And
yeah. I'm wondering, I was just thinking about this with masks and face coverings, whether that would be something that would just become normalized in the United States like it is in other countries.
I think it would.
Yeah. And I also think about like the larger blanket sort of statement for the country, either jiving with or not jiving with the individual states and when they're peaking, right? So, I mean, like it might make more sense for certain states to reopen financially, but not for others, right? I was reading reports earlier, and Meaghan, you could probably shed more light on this as well. Reports saying that in Utah, the cases are going to peak in late April. Others are saying cases are going to peak in late May. I mean, we just don't know yet.
Right. And even within states, different cities, urban versus rural areas, it's going to peak later in the rural areas, probably in many rural areas, but it really is kind of population by population center.
Yeah.
And, that's also, we're probably going to have sort of rolling responses where there's an outbreak. And so now this town has to kind of close down a little bit. And, there was an article called The Hammer and the Dance that talked about some of this, the initial kind of big quarantine to flatten the curve. And that then we would be kind of playing whack-a-mole after that.
Yeah, and it starts to be this long, we do this all the time, but this crisis really brings it to light that this dance of managing risk, right? Like what are we, we're always, there's always risk involved in human contact, right? Like everything we do has risk. There's risk involved in driving and going to work and sitting in a classroom and stuff. So this will, have to think about, many people will think about what is an appropriate or an acceptable level of risk and what is not.
Yeah. And Jenn, I was thinking about your comment about like the masks and will this become like a normalized activity? And, you hear a lot, I think, of pushback of people saying, well, we're not China, it's normal in Asia. But then I was hearing, a news article, it was a radio article where they were talking about how in Hong Kong, it really only became a normal practice after SARS in 2004. Though it really wasn't that long ago.
Yeah.
So these things can actually happen quite quickly and become normal.
Yeah. And I've been thinking a lot about, somebody mentioned the disparities that we're seeing in the effects that this has on people, and even things like masks. There's disparate ways in which these things affect people. Like lots of groups of people of color are not comfortable wearing masks in public. And, that reads differently as a white woman or as like a young Black man. And, that there's so many complicated factors that make these diseases not affect everyone equally, even though we like to say that diseases are democratic or democratizing or, go across borders. They don't listen to socioeconomic stratification or something, but really the effects of them do.
Yeah, viruses don't discriminate, but people discriminate, and that has an impact on how viruses interact with people.
Right.
That's a very good way of putting it, Pamela.
Yeah, well, and it's fascinating as well to hear about how governors are essentially participating in bidding wars to try and get masks. And so you have different state economies that have different levels of what they're allowed to go to, and that dictates who gets the masks.
Right. It's been a sort of catastrophic failure of the of federal level management of this crisis, that's setting states against each other. And we've seen California shipping events that they don't need directly to other states, and I think that's been maybe the most helpful thing that we've seen so far.
Yeah, I was thinking about this, especially Meaghan, when you were talking about the masks. I still have several good friends who are still stationed in Japan, where we were last year. And a lot of them were telling me now, and you can see the conversations playing out on Facebook, that even they're starting to have mask shortages over there. And then in terms of the bases, now they're starting to be quarantined and they can't leave, and essential personnel, this and that. And there's even larger concerns about the types of masks that they can or can't use depending on what ship or like what platoon they're in and all these other things. And one of my really good friends made a plea for friends and family members in the States who could sew to make masks and then ship them over there, so that way they can get the mask to the service members before they deploy. And I mean, I've been thinking about how this impacts the service members too, particularly when you have service members in like carriers or destroyers or small moving cities where the risk of COVID being transmitted is so high and so rapid. And yeah, it's like you would think that when you're somewhere in Asia, like when we were in Japan, masks are so common sense. You see them everywhere and everyone wears them. And now even they're starting to have a shortage in the small town where we were stationed. So it's wild.
Yeah, I think we've seen the first death, COVID death from the Roosevelt, where the captain was relieved and where he himself tested positive. After that, I'm also thinking about we tend to attribute intention and blame to new circumstances, to novel circumstances. Like every year, the flu kills 60,000 Americans, give or take, and when people get the flu, you don't have that kind of search for an origin. We're going to find out who is responsible for this flu, because it feels like it is part of nature to us, because it is an ongoing part of our lives. It's part of the texture of our lives. And so we don't get all excited about attributing meaning to it. But when something happens that's out of the norm, it seems to be very hard for people not to want to embed it in a narrative that has to do with responsibility and possibly intention, which is where a lot of the kind of conspiracy theories are going now. Oh, it's a bioweapon, this kind of nonsense. And so, those novel circumstances make us fearful and make us perhaps more inclined to want to find a scapegoat, to want to blame or other it, to find a target for that sense of, increased urgency that comes with novelty.
It's like from a management perspective, right? If you can try and figure out where it's coming from, or you have the origin, then that's at least one less thing you have to worry about.
Right. And in crisis preparedness, it's all about, the preemptive management that you can do to prepare for a crisis. But when you have this novel event that you can't pull out a case study and look at how other people have addressed something like this. I mean, we're trying to with comparisons to SARS and Ebola and swine flu, but nothing has reached this level, and so people are behind. It just kind of mentally trying to play catch up. And so these kind of heuristic shortcuts of being able to assign blame, I think, can make people feel better when there is that uncertainty, even if it is very, very misguided.
Right. Yeah. We kind of want to fill that gap with a narrative logic, right? There's something we don't understand, so we want to assign it a story, an agent, a motive, circumstances that could have been different, right? We kind of want to understand it in those terms. rather than, again, kind of understanding it as this is new to us, but this is now part of the texture of our lives. Jenn, you were saying something like this a couple of weeks ago, that you have to kind of take it in and realize now this is part of your world as well. This is now part of your ecosystem.
Yeah. I saw Kari typed in the box if we can hear her because she's trying to ask a question. Kari, can you try again?
I cannot hear her.
Me neither.
Can you type something?
Yeah.
Okay.
Okay. She said she'll type.
Okay. All right.
Yeah, I've been thinking about this too, about like what registers as an emergency, you know, and like the fact that this is out of the norm makes it register as an emergency. And a lot of people try to write it off by comparing the numbers of people dying to other things that
The flu.
are mostly the flu. You know, I think we can go the other way with that too and think, why don't these other preventable deaths register as an emergency? You know, like there are lots of other things that we could mobilize and try to find solutions to. But the problem is that they're things that we're used to, or they're things that would require these really big systemic changes that we don't feel like we can make. Whereas, you know, sewing a mask or something like that feels more attainable, which is what I've been doing to make myself feel better.
And very often they're things that we blame on individuals. You know, if we have like mass deaths from opioids, we say, well, they chose to take them.
Right.
You know, and then we start to say, well, within a certain marketing context and prescription context in which they were really encouraged to take them by people that they trusted. You know, we can look at the deaths from air pollution every year, which are just enormous.
Right.
Absolutely enormous. But there, I think, because again, it's a big problem. It's a problem attributed to groups, to large entities, where it's harder for us to clearly assign blame, right? It's hard for us, again, as humans to kind of think, oh, here's a story, but it's this big amorphous thing, this company, and not a person who's doing it. And so then it's kind of, you know, it's like it's the system, right? It's too big to find a way through. It feels that way. Kari has asked.
I think this is related, actually.
Yeah. Oh, yeah. So for those of you tuning in, her comment says, the article her students were reading from her and Lorenzo's edited collection, Endemic, there's a glorious article by Claire Hooker et al. About how when we label something endemic, it naturalizes it and allows us to not worry about the social causes of preventable death. There's a great demonstration about how when the disease doesn't affect Americans, we consider it more often an endemic, like with polio.
Right.
So.
Right, an epidemic versus something that's endemic, right?
Yeah. Viruses don't kill people, people kill people.
Right. And I think we're clearly on our way to coronavirus becoming endemic in the medical sense of the term. That is where it's within a community and that's where it's originates, not coming from outside. But yeah, that language of endemic versus epidemic and pandemic have very different kind of emotional registers for people. So Meaghan, how are you seeing this in the modeling? I mean, as you say, you know, it's hard to compare these. That's what models do, right? We compare these things, but then nothing quite matches up. And then that kind of that room for additional interpretation allows for, again, the entry of narrative, the entry of emotion, the entry of, you know, all the kind of fantasizing that we do. How do you deal with that when you're teaching people to think through the numbers?
Oh man, there's so many different things I could unpack in that. I think the first thing that is really unique to this COVID-19 situation is that it's not just one crisis. There are really so many sub-crises, you know, so we can talk about the public health crisis. We can talk about the economic crisis. We can talk about the crisis within multiple levels of government, the crisis, information crisis. I mean, we have a tremendous issue with where people are getting their information from, which kind of feeds this feeling of uncertainty. And that ties into everything else, like tying into government, where, our president is saying different things than governors. And one of the most important things to do in a crisis response is try to have a clear and concise message. And we don't have that right now, which is very much feeding into some of the kind of public backlash and emotional response.
Do you have any thoughts about the modeling? Because I've heard a lot of people talking about these models, and now Fauci has said maybe, it'll be fewer deaths than the previous model predicted, and a lot of different kinds of, which is great news. But I've seen a lot of responses to that aren't, this is great news, but rather like, oh, he's not reliable.
Or, oh, it was never serious.
Yeah.
Yeah.
Mm-hmm. Oh, the numbers are made up and they're just saying whatever they want. And I think,
I think we have, in our culture, we have, interestingly, I would argue we have kind of this distrust of numbers. Like, people very much want to point to numbers, but they're also very quick to blame numbers. And so that's, I think, why, Leah and I have had long conversations about kind of mixed methods and how, numbers and stories can really work well together to kind of alleviate some of those concerns. With the modeling that we're seeing, Fauci and the CDC, they're erring toward more serious, because if we can say that something is really really serious and going to result in all these deaths, and then it doesn't, then that ultimately is a better thing than if it's the other way around and there are ultimately more deaths. I think what is difficult is that even though there are all these professionals who are doing different models, and they are comparable, I think that that's another really important thing, that these models are being done by institutes all around the world, and they're finding similar things. So this isn't just trusting one organization. There are a lot of people who have been doing modeling. But because this is really unprecedented, everyone's just doing their best educated guess. Right. And my partner is a doctor, and so it's been really interesting to see his experiences, and when he comes home from the hospital and talks about what he has seen. And in Utah, it's been relatively quiet so far. He just had his first COVID patient yesterday. And so it's a weird thing to see those models and have it not connect with what you're experiencing in your day-to-day. And I think that leads to even greater distrust of the models, because we're visual human beings, and we want to see, the numbers reflect what is happening in our lives.
Right. We talked about that a little last time, how the kind of narrative wreck of the economy and of people's, normal way of being in the world is not reflected in what we feel in our bodies very often. And we, as you say, we don't see the sick people, unless we're in the middle of a place that's an epicenter, and we don't feel sick, and yet our lives are upended. And it's very hard for people to wrap their heads around that. And when you add the kind of political polarization and disinformation that's circulating, you have a really toxic mix.
Yeah, and I think for a lot of people, this virus is really going to become real, unfortunately, when they know someone who gets sick, who potentially dies. For President Trump, it was really when Mar-a-Lago had to be, quarantined, that it kind of hit home for him. So we really do oftentimes need that personal relevance for reality to kick in.
Right.
I also saw some psychologist colleagues of mine just published an article about math illiteracy, number illiteracy.
And gloves too.
The challenges of trying to communicate about these numbers. They had done some sort of study, or they were looking at a study with asking people which is larger, 2/9 or 3/7. And a huge portion didn't know or picked the wrong one. So just in terms of the public understanding, when we're when experts are communicating even just the basics of the numbers, and then you add in the fundamental uncertainty of dealing with an unprecedented pandemic, and we don't know exactly how it's going to turn out, and nobody knows exactly what the R naught is, and it's an impossible task to communicate a clear and consistent message with this disease as it's emerging.
Yeah, and impossible in part because we're not doing things like mass testing.
Yeah.
South Korea gives us a really good model.
Yeah.
And Germany give us a really good model because they're testing, they're keeping track of their numbers, they're being transparent about their numbers, and they're showing us what certain forms of quarantine and social distancing can do. But lots of countries, including ours apparently, are not being transparent, are not able to, or not willing to do the kind of testing that would provide this kind of information. I have an ex-graduate student I'm very worried about. She thinks she's getting better, but she presented, someone in her household had direct contact with a COVID patient. She presented, was diagnosed with pneumonia, and then they said, you can't be tested. You're in your 30s. We don't have tests for you. And so, so she's kind of come out, she thinks she's come out the other side, but she still describes symptoms that I find frightening. And she, apparently can't go and get the test and be seen and be treated. And that is really appalling to me. And this is a person who has insurance, and, yeah, it would be equally appalling if she didn't have insurance. But the point is that this is a person who has some privileged access.
Yeah.
Yeah.
Yeah, I've heard a lot. Sorry, go ahead.
I was just going to say, it'll be so interesting to see how some of these social and political issues evolve following COVID-19 and following the 2020 election. I mean, even just the statement of saying she's privileged, she has insurance, it's so relevant to the political landscape that we're all in. So.
Right. And I was thinking about what Andy asked the first day about, we are moving toward, from a model of like personal health and responsibility for health to a public health model, and that's what comes into view in public health emergencies, and that we think differently about the rights of the individual, for example, to a limited number of, of ventilators. But we also think differently about the responsibilities of the individual to the collective, and the responsibilities of the collective to the individual. Mm-hmm. And that is something that's been really obscured in our public discourse for the last, and I mean, not just since 2016, for the last decades. This has become a part of the polarization of thinking from, a sort of conservative perspective going toward a much more kind of libertarian, almost anarchist perspective, where there's no responsibility to the collective or vice versa. And that's just it's not sustainable, outside of some kind of non-existent state of nature.
Mm-hmm. Yeah, I mean, maybe the best, one of the small positives or potentially big positives of this situation is an opportunity for us to imagine different ways of living together and different ways of being a community. I mean, I think I want to have hope that that's what will come out of it. I don't have a ton of hope that that's what will come out of it, but there's an opportunity for that. I mean, even just the fact that we've all changed our lives so drastically, and stopped doing so many things and discarded a lot of things that we realized weren't essential and realized other things that are essential. Maybe there's some opportunity to think about what kind of community we could be or want to be.
Right. And you're right. The timing of it, Meaghan, at the timing of it with this particular election, this particular moment in American history, maybe gives us a different lens on it than would be happening, in another country that's not in the middle of this election cycle, that's not at this particular point of their, political and social arc. So Wow. Well, I mean, we're at 4:37. Kari, what are you thinking? I usually. Oh, okay. It's like it's a half hour. Well, oh no, we've been on here an hour because we usually get talking and have a good time. So what else are we thinking about this week? Jenn, what are you thinking most about in your classes, in your world?
I mean, honestly, I've been having a really hard time teaching during this and keeping up. I know some universities have gone to all pass fail. We haven't. It's hard. I have an enormous amount of grading that I've just been off, and I just keep. It's sort of reframing the way I feel about teaching, because it's making me feel like much more skeptical towards grades and a desire to just be much more empathetic. I mean, hopefully I'm normally empathetic towards my students, but it's making me, I don't know, I'm just really having a hard time focusing on the content, and it's just making me think about the connections between the material and the current and the present day, and what kind of skills and what kinds of forms of thinking I really want to enable in my students. And
yeah, Jenn, I don't know if this is something you've been feeling, but I related a lot to what you just said, because I had a moment last week when I was doing check-ins with some of my advisees through video chat. Everyone was just crying and having a really rough time, and I felt like kind of guilty even expecting to still go through the motions of, hey, here's your weekly announcement, don't forget about your assignments due at the end of the week. And like, on the one hand, I understand the need for us to still have this kind of structure and normalcy that everyone adjusts, but then on the other hand, I just feel like in this moment, there's so much more at stake than maybe a journal entry or a recording. So I've been having a really hard time mentally and cognitively making sense of those two disparate ideas over the last few weeks.
Yeah. I think, and one thing is that we're all in the midst of courses, most of us at least, were in the midst of courses that we had already designed very differently, that were already unfolding very differently. And suddenly we shifted over. So it's not like we designed the courses to do a certain thing and now we don't believe in that thing anymore. It's that, the world really just kind of, the ground shifted under us.
Yeah.
And under our students in big ways. As we go forward, and we're going to be teaching summer courses or possibly even fall courses, we'll be designing these courses more intentionally. But I think you're right. I mean, I see possibilities for designing courses more intentionally, but then I think, what am I trying to do here in this moment? What's the important thing to get across? And I mean, I teach 19th century British literature. So it's, I mean, there are certain skills, but they're scholarly skills. I mean, we talk a lot about the history of capitalism. We talk about war. We talk about theories of history. We talk about all of those things. But at the same time, it's a very different kind of course than a course, for example, where you're teaching numerical literacy and teaching it from models that are unfolding, in the moment. So I think, I do think a lot about that. I mean, I believe that literature is important. I believe that history is really important. And I believe that it can both be a respite and a way of creatively thinking through the problems that we're facing. But I'm going to have to think a lot more about how to design for that.
Yeah. And, I was thinking back on Leah and I were a part of a call on Monday with a bunch of interdisciplinary new faculty at our university, and having kind of a similar conversation, I think, and people were really saying, someone said, I feel like it's taking me twice as long to do things, and I think it's because our minds are elsewhere. We're trying to focus on the task at hand, but there's so much else going on. And it really does make these other things feel trivial. And I'm trying to remember that with my students as well. And I know this too, like it's something happens, if someone has a concern, then it's that much more magnified now online. You know, if there's like a typo on a assignment, then I get, you know, like 10 emails instantly, because, you know, it seems like it's so much of a larger deal because we're not face to face and we're not able to reassure them in that way.
Kari said, the thing is that none of us needs to be focusing on school right now, but the corporate model upon which universities operate is forcing us to engage, students included. And it also makes you wonder, like, is there even any room or space in this larger corporate academic model for the lived experience of the pandemic or the crisis, right? Like, on the one hand, I really appreciate all of the institutional effort to try and make the move online as seamless as possible, right? And for those of us who have taught online before, I think we were a little prepared for that. But I think what I was less prepared for, and this is something Meaghan and I talk about all the time, right? Like how to ensure that we can be there for our students in the best way, right? And I know we're all doing an amazing job, but sometimes it's just hard to know or to feel that we're doing what we can for them on the relational, emotional level that goes so far beyond just, you know, don't forget to turn in your assignment. I hope you're doing well, kind of a thing.
Right. Right.
Well, and it is such.
Sorry, go ahead.
I was just going to say, it's such a difficult balance too, because there is the corporate level and the fact that, you know, our students have paid tuition and you know, so it's like, I want to be supportive and I want to, you know, not feel like I need to hold them to stringent rules, but at the same time, like, I still want to give them a rigorous education because that's something they've invested in, and I'm invested in them for that reason. So it's such a weird balance.
It is. And of course, we're very fortunate to be employed and to have the kind of job that can
100%
stumble on in this online environment. And, you know, if this continues, I think we're going to see a lot of students thinking, well, maybe this summer is a time to finish that degree or skill up in something. And I would bet that especially at the community college level, technical college level, you're going to see an uptick in the next
Yeah. It's making me think as well about the kind of work we do and the kind of work I do, I guess, and the kind of thinking I want to do. Like we've been getting, as I'm sure many people have been getting, we've gotten some emails, you know, from the deans and provosts and stuff reminding us that most of you have more time now. So you should be more productive, you know.
No,
that's crazy.
That is not an opportunity to finish that article. You should have finished last year. Like that.
I am outraged on your behalf.
And so I keep, you know, and I think and I'm about as privileged as I can be in this situation. Like I don't have children. I have a job I can do online. I'm still getting paid. I have a home. Like I'm very lucky. And I do have, if anybody would have more time, it would be me. And I still feel like I don't have more time.
Yeah.
But also it's making me think about like the kind of productive I want to be, you know, like what kind of thinking do I want to accomplish? Is it the kind of thinking that can be like cranked out below, you know, as I push anxiety out of my mind? Or is it the kind of thinking that sits with that anxiety and allows it to produce, you know, real shifts in thought? And I don't know, every part of me just keeps rebelling against this impetus to be more productive during quarantine. But then at the same time, I'm pre-tenure faculty, and I feel like I can't rebel against that. I need to wait to have that personal rebellion.
But your dean should probably be like set on fire.
Luckily, the chair of our department has been more kind, but yeah, it is unsettling to receive that kind of email. Like, get more work done. You know, finish that book.
No, assuming
it's great for your mental health.
Yeah, you have to be a human, and yeah, right now I'm just doing my best. I feel like to just be a human.
That's all we can do.
Yeah.
These are not normal, like, production imperative circumstances, right? Like, we don't have access to our books, our research, our research teams. Like, all of the work on the teaching end has been tripled, quadrupled. Like mentally, we're not in the space with our students where we thrive. Like we're adjusting to managing all of this now at home. Like if anything, this is the most anti-productive sort of space we could find ourselves in, right?
Yeah.
Right. And travel to archives, all of the things that we do in universities. And for the science students, it's arguably even worse.
Oh yeah.
Sure. Yeah.
So yeah, I have a neighbor who had just set up her whole class around collecting this data on site at a zoo, and she had her undergraduates all set up to go and observe these animal behaviors. And now she's like, I guess we're writing papers on whatever you can find on the internet for the next several weeks.
Yeah.
It was closed, and you can't go there, and you should be staying at home. So
my summer class was also supposed to be getting data at our local zoo this summer, and we were like, well, it's closed. Not happening.
Yeah. And of course, the huge in research universities, the huge loss to to research programs that were relying on external funding and relying on having lots of people in a small space working with equipment. All of that has screeched to a halt.
Yeah. Well, and the hiring process within so many universities, I have friends who have been on the job market this year, and everything has just been paused. Their hiring freezes, and like, what does that mean for these universities who may really have needed to fill that position, and it's just not going to happen.
Yeah.
All our positions are frozen except for the offers we've already extended are being honored. I also saw and shared online that the University of Arizona is rescinding offers to students who have not already accepted. That is, graduate students who have not already accepted their funded positions. They've said, well, might be too late for you to accept.
That just gave me goosebumps.
I heard of someone getting a job, like going on the job market, getting one offer, and then that offer getting rescinded, one tenure track offer, and it was rescinded after the hit, I know that there are worse things that can happen in this situation, but man, having gone that just sounds so heartbreaking. And
Kari K wants you to tell her which school in the chat.
I can't remember. Sorry.
Well, do we have any kind of final thoughts for this week as we kind of go into we've got, I believe at this point, the 2 weeks that people are saying are the most dangerous. Now, of course, as we've said, that really depends on where you are and when they started shutting things down. And, so the curve is going to be very, very different in different places. But this is the time we're supposed to be in kind of deepest lockdown. Thoughts about that?
Yeah. We've got some comments. Yeah, so learning how to adjust with family, the base of society, totally spot on. The importance of being informed. Thanks for tuning in, y'all.
Yeah.
And thank you for you all. It was nice. It's always really nice to chat.
Yeah.
Oh, yeah. It was nice to join you all.
Yeah. Thank you for joining us. And it's a great kind of like anchoring moment to the week to kind of, okay, you see good people and process this and kind of mark another week. So
yeah, we're in it together.
Indeed. And thank you, Kari, for organizing this yet again. We don't have your voice, but that.
Right, next week, same time.
Thanks again for joining us for this episode of the Human Capital Innovations Podcast. I hope you stay healthy and safe and that you have a great week.